here at the HIMSS 2016 conference in Las Vegas with Bob Janacek from DataMotion. Welcome.
Hi, good to be here.
So here at HIMSS, we're talking about a patient-centered view of healthcare and how do we make it more patient-centered. So tell us about some of the services that are required to enable a vision of a patient-centered care.
Sure. So in patient-centered care, it's really about empowering the person, as Dr. Robbins says. It's providing services that make it useful for the person to engage in the product, in the technology, actually use it and get better health outcomes. So when you look at a person and in a health context, they may have a care team. They have a nutritionist who may want to get their medical data by fax. Their sister is never going to have a clinical system, but maybe they want to push something to them via secure mail. They may have a specialist that they need to push data to the specialist, the EHR, in a way that the EHR can directly ingest. So in order to empower the person and the person's care team, you have to get the data to the person. So a big focus of DataMotion Health at this year's HIMSS and in 2016 is in providing the technologies that allow the population to engage in access to their data across their various care settings. So whether you get a flu shot at a local pharmacy, or you had an episode where you had to go to the emergency department of a hospital and you were discharged, you see your primary care provider or a specialist for a chronic disease. Across all those different care settings, rather than having a portal for each one of those settings called a tethered portal, which have very low adoption rates, and I just named 4 places where there could be portals and logins to push that data to the person into a smartphone app, into the palm of their hand, so to speak, where if they need to share it with a specialist, share it with their provider, they don't have to get duplicate tests, they don't have to get that second x-ray, et cetera. That's really putting a flag in the next hill of what do we do after we've already empowered the providers to share data. It's bring the patient into their care, bring the person into their care.
Nice. So, I mean, as you talk about those examples, I think a lot of people think, well, isn't my EMR doing that? Why isn't my EMR doing it? What are really the practical steps? Because I don't think the EMRs are doing it. So, what are the practical steps they can do to actually implement some of these technologies?
Right. So, fortunately, in meaningful use stage 2, there was one of the core protocols or measures, capabilities was direct secure messaging. And of the couple dozen measures for meaningful use 2 attestation, direct was a small number, but still required.
Yep.
So the technology to push data is already built into the EMR. The use case for MU2 was about pushing from the transition of care setting from one provider to another, from a hospital to follow-on care, to the person's provider in the field. So what we're saying now is, if we can make the patient enabled with direct, and the hospital can now push that data to the patient, to the person, instead of that person having to log into the hospital's portal, which once you're discharged, the hospital is in your rearview mirror. You're not really thinking about that. A couple days later, when the data shows up in the portal, you're already on to being a dad or being a golfer or being whatever you are in life. You're not really thinking about that care setting.
Sure.
So the hospitals, in the acute setting and in ambulatory, those providers that have EHRs typically have direct built in.
Right.
Sending to the patient direct address is the first fundamental step. Now, how does the patient get that? How do they get this address? Part of getting on the direct network is identity vetting the patient at the same level as a doctor, so that they become a peer node on the network. That allows the data to flow. Once they're identity vetted, a direct messaging address is provided to them. They can access it through our webmail portal, but we also have a range of partners that have created apps that allow the definition of care collaboration teams and such, where it pushes right in. Or even imagine a more every day-to-day use case. Mom has kids in school, and the kids have immunizations and different checkups and such. The school needs a copy of that for to join the sports team or for summer camp, the camp counselor needs it. So even pushing that data for family members, to the family's care coordinator, in this case mom, makes her life a lot easier, where she doesn't have to shuffle around and bring a form to her pediatrician and 3 days later pick it up when it's filled out, and then shuffle it over that.
Yep.
If we could save some time there, that's it's all bonus territory after that.
Excellent. So it's really leveraging our investment in EHR and pushing it out to the patient. Love it.
Yeah, exactly right.
Thanks.
Sure, thank you.